And as we switch over presenters to Dr. Jitendar Sharma, uh, who is no stranger to you and leads this incredible effort in India, where they're actually beginning to implement a national digital health initiative. So take it away, Dr. Sharma.
Thank you, Tom. I start my presentation with a bit of inferiority complex because my presentation does not have very exciting pictures. And for some reason, when I received the template, I thought the template had 4 slides. So I thought I have to fit everything in 4 slides. But nevertheless, please excuse me if my information is not as exciting. But thank you for the opportunity. In the context of telehealth, 4 years ago, the National Teleradiology Program of India was brought out, which now has crossed over 5 million image analysis just by teleradiology. And that's a federally funded program under the National Health Mission. But what we realized over a period of time that telehealth has 5 components. Now, component 1 is the teleconsultation by physicians, which has a complication that the legal act which allows for a prescription does not allow for a teleprescription in many countries. So teleconsultation by a physician always comes with an unknown devil as to who would prescribe and whether that teleprescription would be valid in other regions. The second component is the use of tele-tools like we do in image analysis or analysis of pathology slides. Now, these tools are applications commercially available that make us take a decision based on the capabilities of a software, which could range from theoretically 0% to 100%. And the risks and benefits associated with these tools come generally as part of a contractual agreement between the supplier of the tool and the user of the tool. The third component is non-consultative, non-patient consultative diagnostic telehealth, like teleradiology, teleophthalmology. We also have a large teleophthalmology program in India that operates as part of National Health Mission. And the fourth, in the last component, and the fourth component of the telehealth is the health systems harmonization. Because if multiple systems serve telehealth using multiple standards, there would be a lack of harmonization and therefore lack of interoperability. And the fifth and the last component is the access of telehealth record by patients, which is more to do with the information storage, archival, and use over a prolonged period of time. Now, practically speaking, when a health system battles through these 5 baskets of telehealth interface with the health system, a large number of challenges across a large number of stakeholders come out. And therefore, with the experience of running national programs like teleradiology, teleophthalmology, and so on, and the learnings from those systems, a couple of months ago, on the 15th of August, the National Digital Health Mission was announced in India, which captures the problems across these 5 baskets, across all the stakeholders that you see on the slide right there, right from hospitals to the doctors, to the NGOs, associations, regulators, and the governments, and synthesizes those problems with their potential solutions as a package And that package is National Digital Health Mission, which has a series of interventions. The most important intervention being bringing of a digital health locker attached to every citizen's health profile. A digital health locker that captures the information created by every episode of a patient across every point of the health system and archives them in one place so that it can be accessed, used, synthesized, and applied for patients' health continuum across the care process, across systems. So in a slide, all I wanted to share is that as a country, India has embarked on a very emphatic and very challenging journey, which is creating a backbone of digital health across the National Health Mission, making a national digital health mission. Now, that's regarding the application of digital health and telehealth from a public governance perspective. But many countries like India, including India, also have a very large, very large private healthcare provider base. And if access to health system is possibility in these countries, it is also because of this large private healthcare provider base. These provider bases are fragmented. Some come from some are in the range of small clinics and some network of large hospitals. And small clinics and large hospitals, they have their own choices and challenges with telehealth and digital health solutions, particularly the electronic medical records. And therefore, I just request to go to the next slide. The Digital Health Alliance for India is now emerging with dialogues with global stakeholders as a gateway, as a united platform for multiple providers of digital health that provide services right from patient records to managing health records, hospital records for a hospital, archiving, storage, analytics, and interoperability within systems. Multiple providers of digital and electronic health record systems, the effort is to make them converge on a common gateway so that hospitals that are fragmented, particularly in the private sector, which are small to medium size, can opt to choose providers of electronic medical record systems as per their needs in a cost-effective manner. Next slide, please. Now, the key feature as envisaged for now that the Digital Health Alliance in India would have is one, it would use the data and metadata standards, which are already announced in India 3 years ago. So the commonality across the provider base would be on the legally valid data and metadata standards. Two, it would have a free and a paid basket, free to the extent it's possible to keep the project sustainable, and paid to the extent of choices and features that the hospital seek. Now, what this does is, what this could potentially do is, large number of providers could come on a common gateway, and large number of hospitals could select a provider for a certain period of time, each provider agreeing, more like an airline alliance, to provide a common set of features that are free. It could be as little as patient registration, but even that is important. In fact, the most important step in a telehealth pathway. And two, it could, the various providers could announce the cost at which they provide the additional services like analytics, storage, advanced modules such as that for laboratory or ICU care, and so on. Therefore, even those hospitals, care providers, and clinics which do not have large budgets to implement everything can start their journey from a free basket, which is really small and good enough to start patient records and building upon it with time. And three, it has a very cost-effective approach, and across providers there is a consensus which is being built that the cost of providing electronic health record need not be upfront. It could be more like a rental reagent contract that we are used to in our laboratories, when the machine comes for free, but we pay for reagents every month. So instead of an upfront huge investment on electronic health records and telehealth solutions, which restricts and inhibits a healthcare setup to go for telehealth solutions in electronic medical records, this financial model is more on a cost per bed per month basis, which means like in electricity, you consume and you pay on a per month basis for a certain number of declared beds over the period of the contract, really reducing the cost, the upfront cost of capital and the upfront cost of acquiring these systems. Next slide, please. That's all. Thank you for the opportunity. There are practical solutions like the app for midwife and village level health workers. There are solutions for teleradiology, teleophthalmology. There are also solutions that we have tried 3 years ago on deep analytics on the digital health solutions. But going forward, I think bringing together the demand and the supply, the providers and the seekers together, is where we see the volume of business, a convergence of service models, and the demand pulling the supply like an engine. And that's why the Digital Health Alliance India, that's going forward in times to come. Thank you very much, Tom, for the opportunity, and I look forward to comments and questions.
Great, Jitendar.